All right, guys, we're here with another episode of the Better by the Numbers podcast, where we show you, we dive into how doctors are using labs testing in fresh and unique ways and are thinking of different ways to transform healthcare. I'm your host, Aaron Romano, and I'm joined by our guest, Dr. Shannon Blaylock. I'm going to go ahead and let her introduce herself. And Dr. Shannon, can you just tell us a little bit about your journey and how you wound up in medicine and a little bit about your background?
Sure, I'd be happy to. Thanks for inviting me to be on and sharing my story. So, I am a pediatric cardiologist. I actually didn't plan to be a doctor. I minored in Spanish and went abroad, but here I am. And I grew up in a smaller town in Northeast Texas, and I'm trained and lived all over. The states and the world, and now I have made myself all the way back to where I grew up, about an hour away to serve the community here. It's a fairly large area. It's actually the area that I serve is greater than the size of West Virginia. And when I came, there was only one pediatric cardiologist who lived here. And so that was me. I moved my family out here, and it's been eye-opening and beautiful and hard and so rewarding altogether. And so we do have to think a little outside the box in this area when we don't have as many resources. We're about 2 hours away from a large academic metropolitan area and hospital. So I definitely use labs and particularly just basic labs and genetic labs in a little bit different way because of where I'm located.
Got it. So what are some of the challenges, I guess, that you face being in a rural area? Like, I guess
Yeah.
you're saying this population is small. You're the only pediatric cardiologist. So, like,
Yeah.
how does that affect your location? How does that affect your access to some of these labs?
Yeah, that's a great question. Well, I now have two more pediatric cardiologists. I was able to recruit more. So there's
Nice.
three of us now that live out here. So that's great. Interestingly, I'm associated with an academic facility, and a lot of people don't quite understand. They say, "Okay, we'll get labs when you see Dr. Blaylock," assuming that I have a full ability to do that, but we don't in our clinic right now. We're working on that, but so when I send some of my pretty complicated heart babies to get labs, they can be very difficult to obtain the specimen. Sometimes they are traveling 2 hours to see me, and they need to get back home. So we have an entire spreadsheet about, who's their pediatrician, can they draw labs. For a while we had to know what workers were working in different towns that could draw labs on babies and, that sort of thing. And so it became a little bit different than, hey, just send them downstairs to get labs. So just the access of obtaining the labs from the babies with, major heart issues can be a little bit difficult.
Got it. I can only imagine, man. Okay. And you said you did say you do genetic testing, you do blood, gut, all of it for these babies. And
I do.
can you share a little bit about like what specific approaches you take when it comes to testing?
Sure. So let's just kind of start with genetic testing, for example.
Sure.
Just to give you the lay of the land. So, there's many counties, close to 30. Less than half of these actually have one pediatrician in the county. And so they are served, and we're very grateful for nurse practitioners and family practice doctors. They just may not see the volume of, for example, chromosomal abnormalities, right? I think a lot of people can recognize Down syndrome, and they probably had an example with someone with trisomy 21 or Down syndrome. But I see a lot of patients with what we call rasopathies, aortopathies, lots of chromosomal abnormalities. And so I may be the first one that says, uh-oh, I think we have a chromosomal abnormality, and they may, be 3 or 4 or 5 years old. And I think it's probably just because I'm a focal point, and so I see a lot of the concentration of those patients who have these and heart disease. And so I use a couple different companies, and it was really difficult for them to sometimes get genetic appointments. They may be limited by the ability to get in. They may be limited by their ability to pay for gas or drive 2 hours. And so I wanted to figure out a way how I could do that. And so I've partnered with one of the genetic counselors at the academic center, and she does telemedicine visits. And we partner with a couple lab companies, and we keep the kits in our office. And so we're able to swab a lot of times. Now we can do the cheek swabs and do those, and then send those off. And then if we have an abnormality, we are able to then hook them up with genetic counseling. And so, really and truly last week, I diagnosed somebody with something called Noonan syndrome. So in this exact way, and they were several years old already. So it is not an uncommon circumstance in this area.
Well, I can only imagine how helpful that is actually, because how many people have access to genetic testing in your area right now? How do you decide which tests are worth using, and especially like when a patient can feel like overwhelmed with what's going on, and maybe if cost is a factor as well? Sure.
In genetic testing specifically, we do look at cost. Some of the companies have been bought by the other ones, and so I definitely dive deep into what this means for the patient. And so, we can get an idea of the cost based on insurance or lack of insurance for a couple different companies. But we also have partners within the companies that we can call that can give us an estimate that we can do. And so what we have decided is we will go ahead and take the cheek swab. If there is a concern, a financial concern, and the patients elect not to do that, we don't process it, if that makes sense. But since they're already there and they've driven a couple hours, we go ahead and grab that, and the companies we work with are fine, and we just throw the kit away. So that is one way we do it from a cost standpoint. I am not a geneticist, and I definitely own that. I do have lots of phone a friends. I know a lot of genetic counselors, and work with different academic institutions within Texas to make sure that I'm doing it the correct way. One of the best aortopathy doctors, I talk with her and say, okay, this is what I have. This is what I'm going to do. There's a certain panel. And then once you get used to doing that and you have experience with it, we do that. We are starting to do more of the genome testing, exome, maybe reflex over, and, just learning a little bit more about what we can do, what's cost effective for the patient and what's helpful for them. And so just, the strategy changes over time. For a long time, I did a lot of panels, and I'm starting to change a little bit of that.
Yeah, I understand those panels can be like drawing, like so many, you have so much information, you have to pick and choose like exactly what you need. So,
but we've done it so much that we have I can tell my nurses, this is what we're looking for. And so we select that one. I think for non-geneticists, panels are appealing, because I'm like, okay, I think this kid has XYZ. I would like to choose this panel. But now I'm understanding it a little bit more. Some of the other tools can be just as helpful and not as overwhelming as well.
What about like access to the education on this specific type of testing? Is that everywhere in Texas, or is that, for your specific area, like how many people would you believe has this expertise when it comes to genetics?
For pediatric cardiology and genetic testing? Oh, yeah. 1, 2.
Yeah, that's what I was wondering.
And then that's not tooting my own horn. It's just, yeah.
It's just starting. So like, I wonder how many people are actually catching on, or hey, this could really help.
Right.
Especially in rural areas, like you said, it's just like in the big cities. I live in LA, so like everybody's doing it. You got spots doing it and stuff like that. But I'm just wondering like how many people are looking through it the lens of like, hey, I can actually help, prevent so much if I could just take, see what's going on with this patient.
And when I lived in Boston and such, there were people that were doing it. In Dallas, there's people that are doing it for sure. I think that, just like you said, my lens changed so dramatically. First of all, it's an interest to me, right? Like you walk in and like, oh, wow, I think we have a diagnosis,
Right.
and And it's also, you can put together things from the heart diagnosis, and then I look and I see a few of their characteristics, and it's a little bit easier in my brain to then look at that. But I'm looking a lot, and I think you have to go in there and realize that you could be the first person, and you could change this person, because there are people that they kind of think in silos, right? But when you're in a rural area, you really have to broaden your perspective. These diagnoses are so important, maybe not only for the patient, right? I mean, some of these chromosomal abnormalities, you have to make sure that their kidneys are working okay, that their, blood levels are okay. It's not just the heart. But more importantly is we diagnosed a few months ago a baby with a major issue, and the baby's doing fine, but it was just kind of a subtle thing. And then we got the mother tested, and she had the same thing, but she has a major problem. And so it doesn't just affect the patient. It can, and we do familial testing, and then I help that person get care at the appropriate place. It's not with me when they're an adult, but I do help facilitate that.
Got it. Oh man, I can't imagine how that would be. Like you test something for the baby, and then you test something for the parent, and then they figure something out about themselves that they didn't know.
Right.
That's wow. I mean, man. Okay. What new approaches and technologies are you more excited about when it comes to lab testing? What are some of the new things that you're hearing about that you think could really help or change, revolutionize what you're doing?
Interestingly, I mean, I would love for a little bit easier way to get standard labs. We're seeing a lot, I see patients in two different buckets. One, for me, just because I've been here for quite some time, I have a lot of patients with congenital heart disease. So they were born with a heart that wasn't formed normally. And so the valves are abnormal, the ventricles are abnormal, etc. The other bucket of patients that I see are patients with symptoms. Maybe they've passed out or they've had chest pain and things like that. And so laboratory work for those two populations can be very different. For the ones that have the symptoms, some of those can also be signs like high blood pressure. And so we do a lot of laboratory work there. Sometimes you have high blood pressure because you have sleep apnea or you're overweight or that sort of thing. But some of these patients can have some underlying kidney issues. And I would love to partner with someone to do some more genetic testing, right? So when you have an athletic 15-year-old who comes in, who's not overweight, who has a normal renal ultrasound, I want to see, hey, what's going on with their kidneys if all of their basic kidney tests are fairly normal, but they have this really high blood pressure. And I think there are some new ways to do that. I'm not a kidney doctor again, but again, trying to think outside of the box of how to help people here, because as you probably know, high blood pressure is one of the most modifiable risk factors for having a heart attack when they're older. And so East Texas in general is a pretty unhealthy area. If it ranked in all the states, if it was a state all by itself, it would rank in the low 50s as far as health. And so trying to figure out a way to help people when they're young also helps the family, by the way, and then promote a healthier lifestyle when they're older. So I think genetic testing for high blood pressure is something, and just metabolic disease in general.
You're getting to almost the territory of longevity when you speak of hey, let's detect something early and see something that that could help you throughout your life, so you don't you're at low risk for certain things that could happen to you later on.
Well, old school doctors like me call that prevention.
Preventative care. There we go.
There we go. But yes.
Longevity is a new term, for sure.
Yeah, correct.
How do you see the role of testing changing in the next 5 to 10 years?
I think just if there's some way, and I don't know this, I would love to have just an easier way to do basic testing, right? So we're incorporating a point of care cholesterol test with a pinprick. That's easy, some different things, but some sort of more streamlined, easy process, maybe some kind of crazy development to be able to not do, a venipuncture, for example. Is there some way that we can do other things to figure out that will maybe make it more accessible to our patients? I know that seems kind of crazy, right? And
No, yeah,
no shot sort of thing, but I mean, wouldn't that be amazing?
yeah, yeah. I think you mean just like something that's just like a lot more convenient and
Yes.
yeah, down the line, so you don't have to
Hmm.
like go through all these hoops.
Right.
For the other practitioners listening, what advice would you give about integrating testing a little more effectively into their practice?
Um, we are trying to, just trying to do blood draws at our office. And I know it doesn't sound that hard, but it's actually a bigger hurdle than you can imagine. Using our existing resources and not having other resources. And so workflow processes, we're working on that. Teaching people how to do it, getting buy-in, understanding what facilities are in the area, vendors, cost, that sort of thing. We're doing a lot of that. But from a genetic standpoint, I think that's probably the biggest place that other practitioners like me can start right now. And that is, if you want to do it, right, you need to read about it. You need to understand the pre-genetic counseling. I think that scares a lot of people and they don't know what to do with the test. I'm lucky enough now. I used to not have one, but I have access to a genetic counselor, which is great. But I will say to those who don't, you can still do it. So I met with the genetic companies. We have them come and talk to us. We use their resources. For example, one of them has a pre-genetic little video that patients can watch. There's a QR code to do that. You have to be very diligent in making sure that you follow up. The worst thing in the world, right, is to do testing on someone and it's abnormal and they never know. And that has happened. And so we have a process in place. It's a little clunky, but it doesn't let things slip through the cracks. I think that's really important to think about from a patient perspective.
Nice. Yeah. Is there any one test that you feel is being underutilized at the moment?
Yes, that's a great question. So there are some congenital heart disease panel tests. Um, you know, the way I grew up it is, okay, well, they may have this, let's say they have a complex arch anomaly and something else. I'm like, well, that could be 22q11 deletion or DeGeorge. So we're going to test for that. I would say don't wait until everything points there, right? If there's some subtle signs and some things that, you can either do some panels, you can do some genome testing, but, more importantly, if they have major congenital heart disease, let's look. There are some panels, and I think a lot of people are not utilizing those, and those could really help not only the patients, but our understanding of congenital heart disease in total. So I'm definitely doing more of those.
Nice. Okay. And how would you say you prioritize the types of tests that you're going to use based on the impact?
That's a great question. So for me, I definitely, when I think there can affect their management, let's give an example of a dilated aorta, right? So if you have a certain abnormal genetic test for that, your threshold for doing surgery is lower, meaning the size of the aorta is smaller. So that's how I frame it, is helping that helps my management. It helps me discuss risks. And so things that affect my management with the patient are always top priority. The second one would be consideration of syndromes or abnormalities that have extra cardiac findings too. Like I mentioned before, you can have kidney problems, brain problems, that sort of thing. Let's say if you have a particular type of tumor in your heart, you're also at a risk of having tuberous sclerosis, which is a neurologic disorder that you would need to know about with seizures. And so if there's extra cardiac manifestations, I think that's probably my second tier. And the third tier is, hey, this is a pretty big deal. You had this cardiac event, you're okay, but we need to test your siblings and your mom to make sure they don't have the same thing. And so how it does to your outlying family and treating the family as a whole is probably the third tier.
Okay, good. That actually brings me kind of to my next question. I was going to
Yeah.
say, h- what approach do you take to explain the value of the tests to a patient in a way that they really connect with?
Right. Well, you have to start with what is our basic health literacy, right? So, unfortunately, many people out here do not know what genes are. So, you start with that, excuse me, you start with that versus someone who is really, experienced. And so there's not a one size fits all,
Right.
if that can make, and so I have lots of different spiels that I do
Right.
depending on their educational level and their understanding. But in general, it is trying to understand what we're testing, what we're not testing. That's a really big clarification. And before I even do the test, I talk about, the kind of the three big chunks. Well, if it's negative, what does this mean? If it's positive or pathogenic, what does this mean? And it's a variant of unknown significance, what does that mean? And again, I have now, thankfully, the luxury of having a genetic counselor if we need some more depth. But that's how I approach it.
Okay. Yeah, that's solid because I didn't even think about that. You're right. In Texas, like not everybody's gonna be so not everybody's gonna be so adept to
Uh-huh.
know about what's going on with
Yeah, yeah,
genetics. So,
yeah. And it's
um,
not just Texas. I think sometimes just low health literacy. There's pockets of different areas that are like that. So,
I mean, I'm
yeah.
from Louisiana, so I get it. Yeah,
Oh, yeah,
yeah,
yeah.
for sure.
Yes, yes.
So, if you could leave the listeners with one key takeaway about testing and patient care, what would it be?
Go in with a different lens, right? Don't go in just with a cardiology lens if you're a cardiologist or whatever specialty you may be or family practice. Go in with a wider look, right? Really look at the patient, look at the patient's mom and dad. That may tell you a little bit as well. Try to think outside the box. Some of my best diagnoses have been because I go in with a cardiac diagnosis. I notice that they have a little bit of a short stature. I'm thinking of maybe a rhizopathy. So then I look at their skin really well, which is not always something we do in cardiology. I mean, we do a little bit, but I really look. And if they have these cafe au lait spots, they have something on their chest, they have the cardiac, they have the stature, then I'm like, hey, we need to get you testing. And so go in with a wider lens, wide angle.
Awesome. Awesome. Okay, that's good advice. Well, thank you so much for joining us, Dr. Shannon
Sure.
Blaylock. I appreciate your insights today. And for the listeners, where can we find you? Where can we learn more about your work?
So I actually am developing a patient education tool, which is separate than this completely. It's called cardiogrowmd.com. And so hopefully that will be up fairly soon, and you'll be able to find some of my patient education information there.
Perfect. Awesome. All right. Well, thank you guys for tuning in for another episode of the Better by the Numbers podcast. If you enjoyed today's episode, please share with a colleague or a friend who's just curious about the future of medicine and testing. Don't forget to like and subscribe, and we'll catch you on the next one.
Awesome. Thanks so much.